Jose Vasquez, Executive Director at Common Defense. I'm calling from New York City. And I want to kind of direct my comments to two different areas. One, just kind of picking up where Lindsay Kashgarian left off in terms of how much we're spending on defense. I think some folks assume that, those billions and trillions of dollars are getting spent on veterans after they leave the military. But actually the opposite is true. The right has been very effectively pushing for essentially privatizing the VA. And I think their ultimate goal is to just get rid of it altogether. Folks might not be aware, but the Veterans Administration is like the largest integrated healthcare system in the country. So it's essentially like, our primary experiment with like socialized medicine, right? And I'm sure folks have heard many horror stories about the VA, but by and large, the VA does a lot of great work. They're very comprehensive in their approach to how they treat veterans. Accessing it is not always easy, especially if you don't, if you have anything other than an honorable discharge. So there's often an uphill battle for people to be registered with the VA in the first place. And then it also depends on how many years you served and whether you were active duty or National Guard. So there's a lot of hoops before you can actually access the VA. There's about 16 million vets that are alive today. Only 9 million of them are registered with the VA, and annually they treat about 6 million vets, just to give folks a sense of the scale. I know we want to talk about authoritarianism, but just want to flag for folks that during the pandemic, and since then, the VA has treated over or close to 1 million folks for COVID-19. And throughout the VA system, as according to the VA, they've recorded 26,000 deaths of folks during COVID-19. The VA also had a massive immunization program for COVID-19 vaccines. And so they not only treated veterans, but they also treated their family members, their employees, and other folks in the community. And so the VA was responsible for at least 5 million vaccinations across the country as a healthcare system, which is really important. And so when you think about the fact that in Project 2025, specifically Chapter 20 talks specifically about what the kind of right wing wants to do with the VA. It's all about privatization, which they kind of cloak under the banner of choice, right? They want to give veterans choice, and they are essentially trying to push for more and more parts of it to become privatized to be able to veterans can go to civilian health care providers in order to get treated there as opposed to at the VA. But the problem with that is that, most healthcare providers are not prepared to deal with the kind of comorbidities that many veterans walk in with, and also don't do the kind of extensive research that the VA does for the very, specific things that veterans have been exposed to. For example, Agent Orange, depleted uranium, and, exposure to burn pits, that sort of thing. And so it's scary to think that, while veterans might feel like it's more convenient, for example, to go to a civilian provider that's near them, but I think we've all dealt with the U.S. healthcare system, and it's not exactly a walk in the park. In addition, there's no guarantee that the VA will cover everything that a healthcare provider does in terms of treatment for someone. And so, if you have access to the VA, there's very little out-of-pocket costs. There are some like co-pays for medications. It also has everything to do with, what your disability rating is and that sort of thing, and how long you served in the military. But if you go to a civilian provider, the VA may cover part of it, but you may also get a bill from that civilian provider. And so there's a lot of concern about that. So in addition, I think the to Aaron's point about just folks getting recruited for a lot of reasons, right-wing groups like Proud Boys and Blood Tribe and Three Percenters are specifically targeting folks with military experience because of the capacity for violence and the training that people have received while they're in the military. often what happens is if a veteran joins one of those groups at the local level, they'll sort of become the trainer for the rest of the folks that are joining the militia, right? And so you'll see them, running exercises very similar to what you would see in the military, where folks are doing squad tactics and how to move as a group, how to shoot, how to communicate with each other, and some hand-to-hand combat and that sort of thing. So in addition, the folks that were that have been facing accountability around January 6th, yeah, something like 20 to 30% of the folks that were part of that and that have been prosecuted for that were connected to the military, either veterans, some of them were in the National Guard, some of them even active duty. And so, deeply concerning to think about folks with that level of training. Aaron mentioned some of the gear that people wear, and frankly, some of those folks that showed up on January 6th had better gear than you would get issued from the military. So, it might be tempting to sort of be dismissive of these folks because they're not sort of like professionalized, but I think more and more military personnel or former military personnel are getting involved in these, right-wing groups. So that's the bad news. I think the good news is similar to Serge and many other folks that are on this call, Common Defense is, in our strategic plan, we say we're trying to build the largest grassroots army of progressive veterans in modern U.S. history. So small feat to accomplish there, but we're building a base of progressive vets across the country. Right now, we're focused on 5 key states, which are Arizona, Georgia, North Carolina, Pennsylvania, and Texas. And we've got staff in all of those states. We just recently launched a kind of organizing model where we brought members together and did a state organizing committee retreat. So bringing together vets from across those various states that I mentioned, and doing leadership development, doing de-escalation training. We're doing counter-extremism training with them, and also what to do if these right-wing groups show up and do like a kind of protest or show of force in your communities, like how to document it, how to identify which groups they are based on the kind of signage and how they dress and all of that, which is very similar to the kind of thing we would do in the military in terms of identifying, quote unquote, the enemy. So there's that. But I also think that, by doing organizing with veterans, it's creating an alternative for folks that might be tempted to take that pathway. The sad reality is that folks that are drawn into these right-wing groups have actual grievances, right? That are real, right? Whether it's unemployment or lack of access to healthcare or, the like substance abuse issues and all of that. And I think with the ideology that comes along with these groups, right, that sort of helps them make sense of why they don't have a job, why they can't access healthcare, why the government screwed them over as a veteran and they don't have access to the VA or to education benefits or housing benefits or that kind of thing. And I think the sort of like replacement theory that folks have, which I particularly is appealing to white folks, but don't get it twisted. Like there's people of color are also joining these organizations. You think about Enrique Tarrio and the Proud Boys. He's of Cuban descent, so it's not limited to white folks. And I think that by doing organizing in some of these kind of battleground states, it's important to demonstrate that there's an alternative. Right, there are vets that are organizing in favor of democracy, organizing against the genocide in Gaza, right? Seeing veterans out there and trying to connect the dots between what's happening in Gaza, what happened in Iraq and Afghanistan, and the many other wars that we've been involved in. And and I think that we have been growing by leaps and bounds, which is super encouraging. So excited to share more about the work during the Q&A. And to connect with other organizations that are doing work in those states, but also nationally because we're across the U.S. And last but not least, I think that this election is probably giving people a lot of anxiety. But I will tell you that at least in the veterans community, there is a lot of excitement about this ticket, especially because of Walls running for it, him, seeing a fellow vet involved in that is kind of, bringing a lot of vets out of the woodwork. And, certainly seeing another 4 years of Trump is pretty, just terrible alternative to what we hope to see. And so I think that, from the work that we're doing, it's encouraging to see how much excitement we're getting, how much membership growth we're seeing, how many people we're seeing show up on national membership calls and door knocking and that sort of thing. So I'll stop there and pitch.